Hello, my name's Brett Torrow-Pearce. I'm Head of All Age Continuing Care and Individual Commissioning at NHS Shropshire, Telford and Wrekin Integrated Care Board. This is the first in a series of videos to explain the NHS continuing healthcare process and help to answer some of the frequently asked questions.
Hi, I'm Tom Benjamin. I'm the Business and Operations Manager for the Individual Commissioning Team at Shropshire, Telford and Wrekin ICB. I'm here to give you a slight overview of what continuing healthcare is.
How can I be referred for continuing healthcare assessment?
To get an assessment for continuing healthcare, you need to be referred to our service. The way to be referred to our service is for a checklist tool to be completed, and that is completed by a professional that's trained in the use of the checklist. That's either a health professional or an adult social care professional.
How long before I'm assessed?
So as soon as we receive your checklist and you've been referred to our service and you're found eligible for a full assessment, we'll look to complete the assessment within 28 days of the date we receive the checklist.
What happens during an assessment?
So in anticipation for an assessment, we will contact any healthcare professional or adult social care professional, whether that's an allocated social worker who completed the referral or it's a social worker that's due to be allocated. We will also go and talk to any providers, get care records, and then we will book the assessment. On the day that the assessment booked, all professionals that have been invited will complete a decision support tool, and that is the assessment in itself, and that will help understand your individual needs and whether or not you're eligible for continuing healthcare.
What happens after the assessment?
So once you're found eligible for continuing healthcare, you will have a review within the first 3 months, and then following that, you'll have a review annually. These reviews will help us understand whether or not the package of care is appropriate to meet your needs. Sometimes a review may lead to the decision that a full reassessment is required to understand your ongoing eligibility for continuing healthcare.
What happens if I'm eligible for continuing healthcare?
If you're found eligible for continuing healthcare, you'll be allocated a case manager. This case manager will understand your health needs following the assessment and source appropriate care if is required. If you already have care in place, then we will assume commissioning responsibility for that care, and we will make sure that they meet your needs. We will also organise reviews to make sure that if your needs do change, that the care is appropriate for you.
What if I disagree with the outcome of the assessment?
So if you or your representative disagrees with the outcome, once you receive the outcome letter, on it is instructions on how you can launch an appeal to have your decision reviewed. You'll have to do this formally in writing to the ICB and from 6 months receiving the letter.
What if I have a rapidly deteriorating condition?
In situations like that, a fast-track referral might be required. A fast-track referral is completed by an appropriately trained clinician and will assist in the immediate provision of a package of care.
Can I refer myself for continuing healthcare?
You can't refer yourself for continuing healthcare. Referral needs to be completed by an appropriately trained health or social care professional.
Are there any other outcomes?
So if you're not found eligible for continuing healthcare, there is also the possibility that if you reside in a nursing home, that we will make a contribution to the care provided by the nursing home. This is called funded nursing care. There is also the possibility that we may, in joint working with the local authority, help contribute to a joint funded package of care. The joint funded package of care is where the local authority source your care package, but there are certain aspects of the care package where you have a health need that's above and beyond what adult social care can commission, and therefore we would contribute towards that.